My name is Tabitha Montier. I'm a nursing student at the University of South Alabama, and today I'm going to be performing a medication administration checkoff. So first I'm going to show my ID, and I'm going to quickly scan my room. I'll set this up. Okay, so the first thing that I'm going to do whenever I am preparing for medication administration is going to be to plan for a medication administration that is free of interruption. So I'm going to keep the door closed to the medication room. I'm going to not be taking any phone calls, and I'm going to not be communicating with my colleagues unless it is essential. And I'm also going to adhere to my agency's no interruption zone policy. So the next thing that I'm going to do is I'm going to verify by the patient's medical administration record and the patient's chart my 5 rights. So this is Jaguar Jones, so I have the right patient. I'm going to be administering today heparin. So he has ordered heparin, 5,000 units. So 5,000 units, that is the right dose. I'm going to be injecting this subcutaneously. So this is subcutaneously, right route. And then every 12 hours, which is the right time. So the next thing I'm going to do is I'm also going to check my medication administration record, or MAR, and my patient's chart for any allergies. So my patient is allergic to penicillin. So the next thing I'm going to do is I'm going to perform hand hygiene. And I'm going to select the correct medication. So today I'm going to be administering heparin. So first I'm going to compare it on my MAR. This is heparin, 10,000 units per milliliter. And it expires December 5th, 2025. So it is not out of its expiration yet. I'm going to just show this to the camera. So this is heparin, 10,000 units per milliliter. So I've selected the right medication, and I have verified that it's the right medication with my MAR. And next I am going to verify that is the correct time to give the medication. So on my MAR, it indicates every 12 hours, and it has been 12 hours since the last administration, so it is the right time. I'm also going to verify the route. I'm going to be giving this subcutaneously. So I'm going to select a 1 milliliter tuberculin syringe and needle. And then I'm going to calculate my dose. So this heparin is applied as 10,000 units per milliliter. I am only administering 5,000 units. So whenever I perform dosage calculations, I would see that I would need to administer 0.5 milliliters of heparin. So next I'm going to first uncap my heparin, and I'm going to take an alcohol swab and clean the lid. Then I'll leave it covered, and I'm going to open my syringe using sterility, and I will remove my syringe and discard of my trash. I'm going to remove the alcohol pad and discard, and then I'm going to remove my cap, and I'm going to first I'm going to draw up 0.5 milliliters of air. And then I'm going to inject that into my vial. And then I'm going to draw my medication. I'm actually going to overdraw, and then I'm going to thump to get out any air bubbles that may be present in my medication. So I cannot get those air bubbles out, so I'm just going to re-inject and draw again because I do not need air bubbles. Okay, so I'm going to thump, but I'm not seeing any air bubbles. So then I'm going to push back to the correct dose, which is 0.5 milliliters, and then I'm going to remove, and I'm going to recap using the scoop technique, and then I'm going to show you my dose. It is 0.5 milliliters. And then the next thing that I would do would be to verify with my MAR that this is the correct dose. So I'm administering 5,000 units or 0.5 milliliters, and I have here 0.5 milliliters. So the next thing that I would want to do would be to verify my calculations with another nurse, and if it was indicated, I would also verify my dosage. So the next thing I'm going to do is I'm going to again verify that this is heparin, and I am administering heparin. I have drawn 5,000 units, so I have the right dose. It is the right time. It has been 12 hours since the last one, and I am administering this subcutaneously with this needle and syringe. So what I would do would be to make a label with the patient's name, the name of the drug, and also the dose of the drug, and I'm going to place this on my syringe for whenever I leave the medication room. So the next thing I'm going to do is I'm going to go over to my patient's room. So I'll move over here to my patient's room. I will be taking my MAR and the medication with me. So the first thing that I'm going to do is I'm going to perform hand hygiene. I'm next going to take my MAR and verify that this is the right patient using two identifiers. So I'm going to see that the patient's name is Jaguar Jones. His name is Jaguar Jones, and his date of birth is 08/25/1963, 08/25/1963. So this is the right patient. Now I'm going to verify the right medication. So I have heparin here. I'm administering heparin. I have 5,000 units or 0.5 milliliters here. I'm administering 5,000 units or 0.5 milliliters. I am administering this subcutaneously, so that is the right route, and this is the right time because it has been 12 hours since the previous dose. I'm also going to assess my MAR and my patient's armband to check and see that whether my patient has any allergies or not. I'm going to ask my patient about their allergies, and then I'm also going to perform any pre-checks that I would need to do, such as I had to wake my computer, so that would be a break-in sterility. Anyways, I would do any pre-administrative checks that I would need to. that would be things such as blood pressure or heart rate or whatever was indicated. Based on the medication that I was about to be administering. So I have done my final check. Now what I'm going to do is I'm going to, first I'm going to explain the procedure to my patient, and then I'm going to lower the bed to a comfortable working height, and I'm going to, I'm going to raise the bed to a comfortable working height, and I'm going to lower my side rail. Now I'm going to again perform hand hygiene, and then I'm going to put on clean gloves, and I'm going to don my goggles. So the next thing I'm going to do is I'm going to locate the proper landmark for this injection. So I'm going to be giving this in the abdominal area. So I'm going to expose that area. I'm going to note that there is a 2-inch border around the umbilicus. I do not go below the pubic area or above the costal margin, and I do not go past the anterior superior iliac spine on either side. So that leaves me with a U shape around and below the umbilicus for this subcutaneous injection. So I would expose that portion and select my appropriate site on the patient. So once I've selected my site, I'm going to clean the patient's site with an alcohol swab, and then I'm going to leave my swab pointed to the place that I've cleaned for the injection. Next, I'm going to remove my cap, and then I will, here I'm going to spread the skin. I'm going to do subcutaneous at a 90-degree angle, and then I would slowly insert the medication. And then apply gentle pressure, and then I would discard of my needle and syringe and my sharps container. I would discard of any other materials that I may have in the trash, and then I would cover the patient back up, reposition them back to a comfortable position, lower the bed back to the lowest position, raise the side rail back. I would remove my gloves and discard of those in the trash as well. And then I would perform my hand hygiene. And then I would need to perform my 6th rite, which is documentation. So I would need to document on the MAR that I have administered the medication, and I would also need to document how the patient reacted to the medication. And then after I left the room, I would later come back to check on the patient and see how they were responding to the medication.